USMLE Step 3 flashcards. Meniere's disease. It has periodic vertigo. Patients also have tinnitus and hearing loss, which is unilateral. So, the patient with unilateral hearing loss, tinnitus, and periodic vertigo is Meniere's disease. Next. What is the treatment of HUS-TTP? Some patients with milder form of HUS resolve spontaneously. The patients with severe TTP or HUS are treated with uh, plasmapheresis, steroids, antibiotics, and platelet transfusion do not help. So the patients with TTP and HUS do not give steroids, antibiotics, or platelets. Next, what is the best initial therapy for fibromyalgia? And the answer is the best initial treatment for fibromyalgia is milnacipran, toluexetin, or pregabalin, and exercises. Next, if a patient has a new onset of severe seborrheic dermatitis, you should consider testing for what? And the answer is you should test patients for HIV infection. Next, so HLA allo sensitization increases the risk of what? So the HLA allo sensitization increases the risk of graft rejection in patients who are awaiting organ transplant or bone marrow transplant. And also, HLA allo sensitization increases the risk of platelet refractoriness in patients requiring subsequent platelet transfusion. Next, if the patient has marked eosinophilia and POD or orange peel appearance, POD orange, um, what is it called and what will be the treatment? A patient with marked eosinophilia and orange peel appearance. The answer is eosinophilic fasciitis. You treat eosinophilic fasciitis with steroids. Symptoms of such patients with eosinophilic fasciitis worsen with exercise. What is the threshold of blood transfusion in most stable patients with upper GI bleeding? And the threshold is hemoglobin of less than 7 grams per deciliter is a threshold, mm, as this has fewer complications and fewer rebleeding episodes and decreased mortality. Next, massive bleeding and hemodynamic instability might require blood transfusion regardless of the hemoglobin level, as the level do not accurately reflect the amount of blood loss in patients who has massive bleeding and hemodynamic instability. What is the treatment for spontaneous bacterial peritonitis or large volume paracentesis? Um, You give these patients albumin infusion. Of course, for spontaneous bacterial peritonitis, you will also give antibiotic. What is Smith's syndrome? Polyglandular autoimmune failure type 2. Smith syndrome is the patient has Addison's disease, type 1 diabetes mellitus, autoimmune thyroid disease, and other autoimmune disorders such as pernicious anemia, premature ovarian failure, vitiligo, and celiac disease. What is weakness plus increased CPK plus increased aldolase, and the biopsy is positive? The answer is polymyositis because the patient has increased CPK and aldolase, and the biopsy will show inflammation.